I see people are coming into our electronic room, so I'm going to give them a minute or two to get in and let some more people get on, and then we'll start the presentation. All right, let's get started. Good evening and welcome to the latest Pediatrist Q&A Ask the Pediatrician webinar, Back to School. My name is Ruben Rakova. I'm the Director of Medical Services for Pediatrist and your host for tonight's session. Our panel tonight includes, and if you can give a wave when I mention your name, Dr. Susan Sirota, Chair of the Board of Pediatrist and a pediatrician at Pediatric Partners with offices in Vernon Hills and Highland Park. Also with us, Dr. Nancy Adams, pediatrician at Fairview Pediatrics in Grays Lake, and Dr. Maggie Stefani, pediatrician at Pediatric Associates of Barrington with offices in Barrington and Crystal Lake. Our session tonight will be about an hour long. We're going to try and wrap this up around 7, and it will be recorded. We will be sending out an email to everyone who registered for the event in the coming days with a link to that recording. We've been getting a lot of questions coming in for the past 2 weeks, and we'll get to as many of those as we can. But those of you watching tonight can also submit questions live, either through the chat function of the Zoom call or through Facebook Live. And we'll try and get to as many of those as we can as well. This first question is for Dr. Sirota, and it's one we've been getting a lot of requests for. So it's about COVID, and this one parent asks, I know there's some new data that helps answer this question. If a child has had COVID, do they still need to get the vaccine?
So I think I can give you a short answer in one word. That would be absolutely. But let me give a little more background about that answer. So children do need, and we do recommend COVID vaccines for children who are eligible, even if they've had a COVID-19 infection. And that's because the protection that comes from the vaccine, and another sort of word for protection would be the antibody response to the vaccine, especially against the current and more contagious Delta variant, has really been shown to be better to protect against infection as compared to the natural antibodies that come from having the infection. So another way of looking at this is that what we know now is natural antibodies give about 80% protection against an infection, but the vaccines give closer to 95%. So just in numbers, you can see that's better protection. Also, it's been shown that individuals who have mild illness do not necessarily have as vigorous of immune response. They might have a more limited immune response to an infection. And of course, in kids, most of the infections are mild. Most individuals, though, will have a very robust response to the vaccine. So those are things to keep in mind. If someone has a COVID-19 infection, they should not get a vaccine during the time that they're in isolation or until they've recovered from their infection. So there was a time where we had recommended that if you've had a COVID infection, you should not have a vaccine for at least 90 days. But that was really at a time where the vaccines were scarce and we wanted them to be available for those who are most in need. So even even though those natural antibodies can hang around for about 90 days, and in some cases, maybe up to as long as 10 months, we still want children to get vaccinated as soon as they're eligible because the vaccine gives this superior protection.
Thank you, Dr. Sirota.
You're welcome.
Dr. Adams, this next question is for you. One parent wants to know, quote, what are the risks of COVID to my daughter who has asthma, unquote? What do you respond to that parent?
That's a really good question. And all of the data to date says that a child with mild to moderate asthma is not considered immunocompromised. So they're not at greater risk than the average population. Those with severe asthma might be at more risk for a more severe infection, but those are kids that for some reason may be taking oral steroids for an extended period of time. So things you can do to help protect your child would be make sure they have an asthma action plan in place. Make sure that the school, if they're old enough, they can self-administer and have their inhaler in their backpack. Or if they're too young for that, they should have one in the nurse's office. And the school should also have the asthma action plan. In addition, they should be wearing a mask. They should, what else was I going to say? Make sure that they avoid asthma triggers. Also, washing their hands well, and just in general, make sure they're taking their asthma medications as prescribed. Specifically, if they're on a control medication, make sure that they're taking it daily as prescribed and that they always have their rescue inhaler with them.
Great. That's all good advice. Thank you. In a similar vein, one parent wonders, quote, what does immunocompromised mean? My 9-year-old child was a preemie and he has psoriasis, which is an autoimmune disorder, unquote. So that's a good question with the CDC coming out just in the last week, announcing that a third dose is recommended for those who are quote unquote immunocompromised. And of course, that is up for interpretation. So how would you answer that parent, Dr. Stefani?
Yeah, it's a good question. And I think there tends to be a bit of a misunderstanding around the term immunocompromised in general and sort of what the immune system is capable of. Really and truly, when we talk about people that are immune compromised, it's a really small group of people. And so it tends to be anybody whose immune system response is likely to be inadequate when faced with stressors and things of that nature. So typically the things that the CDC is identifying are cancer patients, perhaps while undergoing treatment, somebody who is a bone marrow transplant recipient or a solid organ transplant recipient, somebody who has like a congenital immunodeficiency, or somebody with advanced or untreated HIV. So obviously it's a very, very small set of patients, and hopefully and thankfully not a huge percentage of the patients that we care for. So most people are not going to fall into that category, thankfully.
Right. Thank you for clarifying that. Dr. Sirota, one parent is concerned about the risk to the newborn in the home now that the older children are going back to school. I'm sure a lot of our parents on the webinar tonight have a similar circumstance. Do you have any tips to reduce the risk of illness, COVID or otherwise?
Yeah, absolutely. And when we look at newborns, and we've given advice all along as pediatricians for newborns, we've always talked about the importance of protecting newborns, especially in the first month or first couple months of life at home. So in many respects, a lot of the advice we give, even though we're in this pandemic, hasn't changed that much. And I also want to say in answering this, that as we've gone through this pandemic as families and as parents, we are continually having to make decisions where we're balancing the risk of one thing versus the risk of acquiring the illness. So in the case of newborns, I think we continue to take the same approach we've been taking throughout the entire pandemic. Masking, good hand hygiene, distancing, because these have proven to be effective and should be followed. But when we have older siblings of newborns going to school, we want to be sure of a few things. that they are doing these things in schools, so that they're wearing a well-fitted mask, as Dr. Adams just said, and that they keep that mask on throughout the school day, and that masks are worn regardless of vaccine status. It's helpful in Illinois that we now have a mask mandate in school for everyone, vaccinated or not. And then the same goes for parents who are going to work outside the home. Even if there is not a mask mandate in their work, it might be a good idea to keep a mask on indoors at this time, especially with the more contagious variant that's circulating. Good hand hygiene in the home is important, as well as good hand hygiene at school. And it's really also important to give particular attention to really good hand hygiene, washing when kids come in that door, the older siblings when they come home from school. Because we want children to be in school, and we learned early on in this pandemic, it is not good for children to not be in school. We have to balance the risk of sending the older kids to school against maybe reducing the risk from other things some of those kids might do. So this might be a time, if there's a newborn in the home, to really not have regular indoor play dates with children from other homes, or maybe sending your child indoors to someone else's home, even with masks. It also might be a time to really cut back on those extra activities that kids do during the week if they are going to occur indoors with several children from other homes. I think you can also consider, if you're going to have individuals coming into your home, and that should be limited as far as who comes into your home if they don't live with you. Even if those individuals as adults are vaccinated, you might consider having them wear a mask when they're in your home now around a newborn. And I give this advice because of the time we're in right now with COVID and going backward a little bit. And that's just similar to what we're doing with kids in school right now. We're saying when we're indoors, we're all putting on masks. I think we also have to try to ensure that the individuals that are going to have close contact with your child, other than their siblings who might not be eligible, but all those other individuals are fully vaccinated if they're going to come into your home and have close contact with your child. And not just fully vaccinated from COVID, but when flu vaccines come out in a couple of weeks, that they're fully vaccinated for influenza. And if they're individuals that are eligible for a booster for pertussis or whooping cough, that they're also vaccinated for that. So we really want to protect these newborns from not just COVID, but other things that could put them at risk of some serious illness or maybe even hospitalization. And then finally, if your school-age child, or the older siblings who are going to school develop illness, don't panic, but we want you to keep them home if you can, somewhat separate them from the newborn, and then call your pediatrician, because if your child has COVID-compatible symptoms, we're going to want to see them, we're going to want to test them and rule out COVID, and then we're going to be able to give you the best advice as far as how to manage things as a family, particularly in light of the newborn in your home.
Thank you. Very thorough. So likewise, how do we keep all the kids who aren't old enough to be vaccinated safe this year while they're at school, after school activities, play dates, playing at the park, etc.? Dr. Adams, what would you say?
So to reiterate kind of what Dr. Sirota said, they need to be wearing a good fitting mask at all times when indoors or on the school bus. Schools should implement like a 3-foot social distancing policy. It's come down from 6 to 3 feet. And I would ask your school about their disinfection and cleaning policy as well, and their ventilation system, to make sure that the school is well ventilated and that they're disinfecting and cleaning the school every night. And again, vaccinate your children when and if they become eligible. And on play dates, I would avoid things like eating indoors together, any activities such as like singing or karaoke or playing an instrument, anything like that, that they could spread germs to one another by doing. I would avoid that completely, and have them play outside as much as possible, weather permitting. And then again, wash their hands really well when they come in from playing outside, and that will help protect them.
Great, thank you. We got a live question that came in from one of our attendees tonight, and it's directed at Dr. Stefani. And in fact, it actually starts, "Hi, Dr. Stefani. Have you heard about the shield testing in Crystal Lake? They will have children tested weekly for COVID via swab. Do you see any cons of this? What do you say?
So I really don't see any negatives with this. I have listened in on some of the talks that the IDPH had been doing and trying to understand how best to approach this school year. And I think, at the end of the day, we've said this, we're all just trying to come up with the best path forward that we can find that will keep kids in school as much as possible and will cut down on unnecessarily closing classrooms, isolating children longer than needed, but at the same time, identifying children who actually do need to be removed from the classroom. So my take would be that the SHIELD testing, which is a PCR test, so it's as accurate as we can offer, can allow us to do that. And especially since it's a saliva test, it's less invasive and easier for kids to tolerate, which makes doing it routinely not as disruptive or stressful for the families or the children. So I think, as this year unfolds, we're going to continue to look at our options and look at how things are going and make changes as we go. But I think it's a really reasonable thought in terms of ways to do a little bit of screening, isolate children who need to be isolated, and at the same time, hopefully keep everybody else in the classroom.
Thank you. Now, we've got a lot of questions over the last few weeks about vaccines that aren't even approved yet. So what can you tell us, Dr. Sirota, about the vaccines for those who are younger than 12? When does it look like that's going to be ready? Will it be 2 doses? And one parent asked, do you think it's safe, even if it has emergency use authorization and not full formal approval from the FDA?
So I'm going to answer this question, and there's lots of parts of the question, so remind me if I don't get to all of them. But I want to focus my comments or my answer on the Pfizer vaccine in particular, because that's the vaccine that's likely to be first approved for children under 12 years of age. And right now, it's the only vaccine in the country under emergency use authorization, which we do consider safe, is the Pediatricians at Pediatrics for children for whom it's authorized, 12 and up. So the $1 million question, though, among all pediatricians across the country and probably in many other places in the world, is when are we going to be able to vaccinate the majority of our patients? And it's really important because children represent 25% of the population in our country. So what I can tell you is that in March of this year, March of 2021, Pfizer began their study of their COVID-19 vaccine in children. So the first dose to a child who was in the age range of 6 months and 11 years was given in March of 2021. In that study is about 4,500 children, and it's a diverse group of children that's being studied across 4 different countries. One of those countries is the US, and the other 3 are in Europe. And there are really 2 endpoints to this study that's going on now. And so it's a little different than the studies that were done in adults. In adults, the endpoint was give people the vaccine, send them out in the world and see if they get COVID. And if they do get COVID, how sick do they get from it? But in children, what we're doing is we're looking at first their immune response, and then second, the safety of the vaccine. So if you look at the immune response, what's going to happen is the immune response that children are mounting to this vaccine is going to be used as a proxy, or it's going to be used to infer the effectiveness of the vaccine in preventing disease altogether and then preventing any serious or life-threatening disease. And they do that by something that's called immunobridging, and it's where you take the immune response that we get in children and you compare that to the immune response that they saw when they studied 16 to 25-year-olds. So that's the first endpoint, is immune response. And then the second endpoint is safety. So we need to make sure that these vaccines are safe in children, because children are just not mini adults. There are some differences in children's immune systems, immune response, and other nuances. So children are being studied sort of in 3 groups: 6 months to 2 years of age, 2 years to 5 years of age, and then 5 years to 11 years of age. And the other thing we have to do with children is we have to determine the dose for the vaccine. I know the question was, are there going to be 2 doses? But we also have to determine the dose of each of those individual shots. And so there's what's called a dose escalation, where we start with a smaller dose and then move up to the same dose that's been given to older children and adults. And of course, the goal is, as long as it's safe, is to try to give a higher dose, with the idea that that would probably lead to an even better immune response. So Pfizer has also come out to say that they may even look at safety and dosing in children under 6 months of age, which is unusual for vaccines like this. For example, our flu, we only give at 6 months and up, but they might even look at 6 months and younger once the safety in children 6 months and older is determined. And that's because COVID-19 is such a serious infection and we want to get through this global pandemic. So what can we expect to see, or really when can we expect to see this vaccine for our kids? I'm asked that every day in the office, and it's dependent, I think, on three things. First, Pfizer has continued to report, and even if you go to their website today, you'll see this, that they will be requesting emergency use authorization for their vaccine, their mRNA vaccine, for approval to be used in children 5 to 11 years of age. And they're going to go to the FDA with that request, at least at this point, we're told sometime between September and October. That's their time frame. And then they hope to soon after seek approval for 6 months to 5 years of age. However, about a month ago, the FDA did ask both Pfizer and Moderna that they include more children in their studies. And the idea was that if they expanded the number of children, we would have even more confidence in safety, because if there were a very rare safety concern, we might still be able to see it with a much larger number of children in the study. The number of children that are in the current study is the typical number of children that are usually studied in a vaccine study. And then the third part is what's going on with the American Academy of Pediatrics. And the American Academy of Pediatrics in the last 2 weeks has come out to put a lot of pressure on the FDA, really saying, look, we have a lot of sick kids in this country. We have a lot of sick adults. We have this Delta variant spreading, and we need you, FDA, to approach vaccinating our children with the same urgency that you approached vaccinating adults last winter. So we have all those three components at play. And although I don't have a great answer, I think when all of that comes together, we should expect that at least 5 to 11-year-olds will be seeing their first dose of vaccines sometime between late fall and late winter. And I wish I could be more specific, but things change every day in COVID, and hopefully we'll get more detailed information soon. But what you can be sure, I know there might be some non-Pediatrix patients attending this, but what you can be sure is we already have Pfizer vaccine in Pediatrics. We have been able to vaccinate all of our patients 12 years and older who wanted vaccine from us, and we will have vaccine for your children, and we will have a very easy way for you to get vaccine from us as soon as your child is eligible for vaccine. Please know you can count on us to vaccinate your children. We are already doing that as a practice.
Thank you. All right. Dr. Stefani, if an unvaccinated child is playing outside without a mask and not socially distancing, is she safe simply because she's outside?
So this comes up a lot. I happen to, in my own household, have one child who's eligible to be vaccinated and is, and one who is not eligible yet based on age. And so we discuss this all the time. I think the thing to remember is that I would probably say it is safer, but I don't know that anyone's going to ever be able to say that anything is absolute. Certainly, I think our goal with the kiddos who are unable to be vaccinated based on age or anything else, anytime we can be outside, open to air, it definitely mitigates a lot of risk. That being said, I think we all have to use good judgment, sort of know the company we're keeping, try and understand a little bit about, whether that individual's family is vaccinated, whether this is a family that's typically being cautious in their movement through the world. Are they masking other places? And it just happens to be that their child is not masking, when they're outside at the playground. I think that it's definitely our best option, especially in an attempt to keep as much normalcy for our little ones as we can. So I definitely think I lean towards an outdoor opportunity whenever possible. If you're talking about something like a playground that's full of a lot of kids, I know a lot of communities really push to have the kids in masks when they're going to be on a lot of shared equipment and things like that. So I think some of it will come down to what the actual environment that you're in looks like. But I do think in general, being outdoors is one of the best sort of safety precautions we can put in place for our kiddos who are too young to be vaccinated, but still trying to socialize and be around their peers.
Thank you. Dr. Adams, this next question flips it around a little bit. one respondent sent in a question, quote, I'm a fully vaccinated teacher. Should I wear a mask at work to provide extra protection to my children, unquote. Now, I'm not sure if the teacher means his or her own children at home or the students in the classroom, but either way, how do you respond to that parent?
So the short answer is yes, absolutely. You should wear a mask. Wearing a mask helps protect you, but also your children at home and the students you're teaching. And so that's kind of why the IDPH, the AAP, CDC is highly recommending a universal masking mandate when indoors in all K through 12 schools. For all teachers, students, staff, and visitors. So, and just make sure that the mask completely covers your nose and chin and doesn't have a lot of large gaps around the side, as that provides both you and others the best protection.
Thank you. I want to thank Dr. Sirota, who answered a couple of questions on the chat. Specifically, there was a question about COVID tests and can most tests or any test determine if it's the Delta variant or some other variant. Most tests nowadays really just tell you if you have COVID or not. Very, very specialized labs, usually run by some agency of the government, a state lab, county labs, CDC. They can test for the various strains of the virus, but most places can't do that. Walgreens, Costco, CVS, our Pediatricians offices, we just tell you if you have COVID or not. And there's a couple of other questions that she answered in the chat. So those of you who are on the call can look and see those questions that were asked and answered. Dr. Stefani, one parent asked, is it safe to send my 3-year-old and 14-month-old back to daycare? I'm worried because of the Delta variant, especially for my 14-month-old who doesn't wear a mask. Should I get him masks? Is it relatively safe to send them to daycare?
Yeah, this is a really good question. And to be honest, I think it is the state of affairs for many families in our community. It's simply not an option to not utilize daycare of some kind. Under 2, they really aren't recommending masks. And so again, I think that what we typically have to rely on, and I think at least in our office, we've seen this to play out during the pandemic thus far. We've had many, many children who've been in daycare throughout the entirety of this process and done really well. And obviously, I think the most important things will come down to how individual daycare centers are handling this. You know, the masking policies of all of the employees, the disinfecting policies, how they're working on, you know, managing the children in the office, or I'm sorry, in the classrooms, and what are the criteria to be in class versus having to be home as far as illness and the criteria. So I absolutely think that it is very reasonable for families to continue to utilize daycare facilities, even for kids who are too young for masks. I just think it's really important to do everything we can to be informed about how the daycare is going to handle it. And it's one of the things that we've been doing a lot of in the office, because we have the ability to see children when they have cold symptoms and do appropriate testing so that they can, you know, get a good plan together with their daycare facility about when they can return. So I definitely think so. We just need to be informed and prepared.
Thank you. Dr. Sirota, we're going to go back to you because we got a follow-up question that came in live tonight, a follow-up to the vaccine question that you were speaking about earlier. And the question is this: following up on the safety of the vaccine study in children, is there any data on the impact of the vaccine on reproductive development?
Sure. Well, I think it's very important to address this idea that having a COVID vaccine is going to lead to impaired fertility. And this is an issue that was raised many, many months ago in a theoretic question from someone who once worked, I believe, at Pfizer. And it had to do with the idea that we're mounting antibodies to spike protein, and there is a protein that is in some ways similar to a spike protein that exists on placenta. But as it turns out, there is absolutely no science to support the fact that there would be any interaction there. And now that we've given, worldwide over 1 billion doses of vaccine have been given, but now that so many doses of vaccine have been given in our country, and pregnancies, many pregnancies, probably somewhere on the order of 40,000 pregnancies have been followed now in data that's collected through VSafe, through the CDC, we know that there are no signals to suggest that there is any negative impact on fertility or reproductive health because of taking this vaccine. So it's very important. There have not been higher rates of miscarriages. There have not been higher rates of other complications that might suggest infertility. And in fact, although we started giving this vaccine with the idea that pregnant women could have a choice as to whether they wanted the vaccine or not, we now have enough research and medical evidence that there are very specific recommendations for pregnant women to have COVID-19 vaccines, because women who are unvaccinated have a higher risk of ending up in the ICU and very serious with COVID-19. And they also have a significantly higher risk of delivering infants who are not only premature, but who are sick and can have complications of prematurity. So we should feel very confident. And I will just say, on a personal note, I'm a mother of 2 older teen women / young adults. They think they're adults. And I had absolutely no hesitation in recommending and really insisting that they have their vaccines.
I have 4 such women in my family, and they all got it too. They range in age from 19 to early 20s, and they all jumped at the chance to get it. So yeah, I certainly agree with everything Dr. Sirota just said.
Agreed, and my 12-year-old daughter got it as well.
There you go. We got a lot of questions about masks at school that became a moot point when the governor instituted the statewide mandate for masks in all grades K through 12, but that may change. And we know that things change very quickly with this pandemic. So Dr. Adams, what's your view on the situation in which a school district says masks are optional if that happens? Is that safe, especially in elementary school where the kids cannot be vaccinated? If masks become optional, would you recommend that we mask our children while in school?
So, good question. I think all schools in general are trying to make it as safe as possible for kids to go back to school. And I know myself and all of the pediatricians at Pediatrics are in favor of in-person learning. It's important for both academic aspects, but also social, emotional wellness. So I do think, yes, it's safe, that your children would be better protected if they wear a mask. It helps protect both them and others. And basically, masks work best when everyone wears them, which is why this mandate is in place for universal masking. And additional ways you can help is like change up the nighttime routine. If your kids don't have after school activities, have them take a shower and wash their hair and then get into their PJs and do like homework, dinner in their PJs so that they're nice and clean. And that will help, obviously clean off any germs or that they've come into contact with at school.
Thank you. Dr. Sirota, speaking of masks, one parent wrote in earlier, will my kindergartner's learning be impaired if she can't see the mouths of her classmates or teachers? We got a lot of questions about the risks of masks. One came in tonight, a report that wearing masks is quote unquote bad for children due to their developing brain. They're breathing in carbon dioxide that may be trapped in the mask. Is this true? I'm concerned that my kids will be in a hot school all day with a mask. What do you say to those parents who have concerns about the masks?
Yeah, so, we probably should start with, why don't I start with debunking some of the most common myths, including the one you just asked about. And that's often the elephant in the room when we start to have a conversation about COVID vaccines, because because of social media and because of information that can be shared on the web, it is very easy to happen upon information that seems like real science that is really what I would call science fiction, meaning not real science, or just disinformation about COVID and COVID infections and all of the other ways we're trying to get past this pandemic. So if we look at some of the most common myths, I would say, first, I want to make it clear that masks do not block oxygen intake. That's one of the myths that I've been asked about. And for that reason, masks do not affect lung function and they do not affect lung development in children. So that's number one. Number two, there are these reports that you can find on the internet or in Facebook groups about CO2, carbon dioxide trapping, and then the rebreathing of carbon dioxide. That's called hypercarbia when that happens. And that is not good for brains, but it is absolutely false and has been disproven. This does not happen with mask wearing. Number three is that wearing a mask could weaken the immune system, and that is absolutely not true. There is nothing about wearing a mask that interferes with the function of someone's immune system. But what masks do is they are breathable, yet they still do an excellent job as a barrier, and they prevent the spread of infection. And in particular, they've done that very well through this pandemic that we are all living through for almost a year and a half now. And we see that ourselves. We see it in our own offices every day, where we had virtually no COVID-19 vaccine infections acquired in our offices at Pediatrics because we were so strict about masking from very early on in the pandemic. So what about learning? What about development? Because I think that's what the original question was about a kindergarten child. And, I want to tell you that it is different for children if they're in an environment and they're learning from us as their parents, their family members, or their teachers when we're all wearing masks. But the bottom line is we want children to stay healthy, stay safe, and be with us. So we have to keep safety first in mind. But I think it's interesting to say, well, what about these studies that they did when they looked at the development of speech and language in visually impaired children? And how did that compare to their typical peers? And it turns out that we have no studies that are showing us that masks delay speech and language development. And children who are visually impaired, as I've just said, they develop their speech and language at the same time as children whose vision is not impaired. So I think that's really important information we can think about and not have as much worry about development and learning with masks. And then some very recent studies that have come out as we've been in the pandemic for over a year now tell us that because children can't rely on seeing mouths, that they have become and adapting, right? Children are very adaptable. They have become very successful at paying attention to things like eyes, to our body language, the words that we use, and our tone of voice. So those are the things to keep in mind. And I think we have to look at this as sort of, this is the cup that's half full. Our children get to go to school. It's so important for their emotional and developmental well-being to be in school. And because children are so adaptable, they're really figuring out how to be just as successful. But whether you're a teacher, whether it's your own children's teacher, or whether it's us as parents spending time with our children and promoting their growth and development, there are a few things that we can do to make it better if we're in situations where we're all masking. So it's really important to first get a child's attention, because if we get their attention, it's easier for them then to maintain focus. And it's also helpful to kind of limit distractions. If we're spending time with masks and we're trying to deliver important message to children, we should face children when we're speaking to them. We probably need to slow down a little bit, maybe increase our volume a little bit. And then we can think about the things I just mentioned, using our eyes, using body language, using our words clearly, and also our tone of voice as we're teaching or we're promoting their development, especially young children, because so many of them are spending so much time at home, but they may be in a daycare, for example, where everyone is masking. And then finally, if we are communicating or teaching with masks on, we should check in more regularly than we normally do with children and just make sure that they are understanding what we're communicating to them.
Thank you, Dr. Sirota. Sage advice. Now, Dr. Stefani, I have another question about masks. Now that Dr. Sirota has, I hope, settled the question of whether masks are bad for us. They are not. There's another question. What's the best type of mask for children to wear? Do they need, for example, an N95 mask? And one parent asked tonight on our chat, with Delta variant being so contagious, are cloth masks still useful?
Yeah, these are really good questions. So I do not believe that an N95 mask is required for children. The CDC recommends that we're doing at least 2 layers of a washable and breathable fabric. Obviously, the fit is really important, and everybody's face is a little bit different. They recommend that the wire bridge above the nose can help sometimes in terms of getting that secure fit. You know, when they talk about trying to minimize gaps, it's obviously a little bit tricky with kiddos. So you're looking for sometimes things that have adjustable straps around the ears so that you can make those cheek pieces a little bit more snug. I think it helps a lot too to get a little bit of feedback or buy-in from the children. I know at my house, one of the things we tend to do a lot of is bringing a couple of options into the home and letting everybody see, you know, which one pinches my ears, which one do I feel like I can, you know, be most comfortable in. So that I think if we give kids an opportunity to weigh in on that a bit, that will help, and it's probably going to increase their success with it during the day. But I think if we're looking for at least 2 layers of a breathable and washable fabric, something that's going to really clearly cover our nose and our mouth with a nice, good fit, and sometimes that nasal piece, like that little metal nasal piece, will help us to keep that fit.
Thank you. That's good to know. And just for those of you who ask about N95s, I will say that an N95, to be truly effective as an N95, needs to be fitted by somebody who knows how to fit an N95 mask. There's a specialized people who can do that. So if you just buy an N95 off of Amazon and put it on, it's no better, no worse, but it's no better than a cloth mask. So don't waste your money on N95s unless you have somebody that you know can fit it to your child. So good advice. Thank you, Dr. Stefani. Dr. Adams, I'm going to give you a question that came in over the last couple of weeks that has nothing to do with COVID.
Yeah.
Can you please provide some suggestions of healthy meals to pack for school that are popular with kids, yet healthy?
I sure can. I have an 11 and 13-year-old, and we go through this a lot the night before school often. First of all, I would say get your children involved so they have some ownership over what they're eating for lunch. And they also know, you know, that they're going to get something they like because they've had kind of a say in it. You can also help them or have them go to the grocery store with you and pick out healthy items. I would also encourage that they make sure to stay hydrated, like 6 to 8 glasses of water a day. And if a lot of kids are like, oh, I don't like water. Well, try putting water in a pitcher and throwing some fresh fruit in it overnight to give it a little flavor that might entice them into drinking it more than usual. But I would suggest incorporating all the food groups. So fruits, veggies, lean protein, low-fat dairy, and whole grains in the lunch. And, you know, for those who have younger kids, if you want to make it a little bit fun, like if you make a turkey and cheese sandwich, stamp it out with a cookie cutter. So mixing it up once in a while, I know that takes more time, but it can be fun. So I would say things, obviously like lean deli meats, cheese, mustard, bread, or no condiments whatsoever. Things like sun butter, because many schools are peanut-free. Sun butter that you can dip celery in with some raisins on it to make like ants on a log or something of that nature. Things like hummus and pita or hummus and carrots are also a huge hit. Vegetable sushi, making pinwheels with deli meat and cheese and rolling it up and slicing it is also really fun and a low carb, healthy snack. Any vegetables, obviously, with a lot of kids like ranch, try to substitute in things like hummus once in a while, yogurt, and also for those that are peanut free or their schools have a lot of restrictions with regard to that. If you're in a jam, there's my girls really like this company makes made good. It's what it's called, made good, and it is peanut, tree nut free. It's also gluten free. It's free of all common allergens. Basically, it's organic, and they make things like granola bites, little granola bars for, and are great for a sweet treat. I mean, I could go on and on. Leftover grilled chicken from the night before, you can dip it in hummus or something of that nature. Baby Bell cheeses, the spreadable Laughing Cow cheese with, a few crackers or something like that.
It's settled. I'm coming over to your house for lunch tomorrow.
I know, right?
Like a lot of fun.
I don't do that every day.
Dr. Stefani, I'm going to go back to you. We got a question that came in over the last couple of weeks, and somebody asked a very similar one in the chat tonight. We all agree that keeping our children out of school for much of the past 18 months was not a great thing for them, and we're all excited for them to go back to school. But one parent asked specifically, quote, "Are there any populations of kids who should not attend," unquote. And one mom, to give one example of this, one mom wrote in tonight, "My family has an immune compromised family member, and that worries me if my son will bring COVID home." So what do you tell parents who have an immunocompromised person at home, or whose child, him or herself, is very immunocompromised? What do we say to them?
So it's a tough one. I think gratefully, the list of people that I would recommend not be in school is exceptionally small. In my mind, it would be if I happen to have let's say I had a high schooler who was with a new cancer diagnosis and was initiating chemotherapy and was going to be meaningfully immunosuppressed. Or we've occasionally had kids who've had like an inflammatory bowel disease who are having to do an infusion of a brand new, very high, immunosuppressive medication. I think those would be the only situations that I might temporarily recommend that somebody be out of school. I think the biggest struggle for all of us is watching what a mental health toll that this whole process has taken on our adolescents in particular. And I think that, this question has been posed to me in my practice about, if they've got a more distant or extended family member who's going to be immunocompromised. I think we really have to prioritize our ability to get the kids back in school, even if it means at times needing to make modifications to how we interact with the people that are immunosuppressed. I mean, again, it'd be one thing if it was last March, but given that we know these are modifications we're going to have to make for a long time, I think it really, really has to be a priority as much as possible to get our kids in school and make whatever accommodations we need to, whether it's vaccines, whether it's, HEPA filters in the home, whatever it is that we can do to protect anybody else that's vulnerable. I think we really need to try and prioritize our children's in-person learning whenever possible.
Thank
Is
you.
it okay? I think I want to add, that was a great answer. Thank you, Dr. Stefani. The one thing I do want to add, because I suspect some of the people attending or who will listen to this, because I know we're recording, may have very unique situations with their own children or unique situations with their family. And I really want to encourage you as parents to talk to your pediatrician, physician, or nurse practitioner who takes care of your children. They know your family best, they know your children, and they really can work with you in that shared decision-making process to determine what would be best for your child or what would be best for your family, or how best to navigate the situation so that you can continue to fulfill this priority of having kids in school for in-person learning. But really reach out to your pediatrician, because as we've said all along, I mean, I can think of the first time we did one of these Q&As over a year ago, there's a lot of decision-making, and it's about understanding risks and balancing risks, and your pediatrician knows best how to do that with you.
Thank you. All right. Here's a very basic question, Dr. Adams. Is the bus safe to go to school, or should we drive our children to school? What do you think?
So I think the bus is safe. Regardless of your school's vaccination policy, all passengers and the drivers must wear masks while on the bus. This is both in public and private schools. It's a universal mandate. And while there's no COVID limit for the number of passengers on the bus, I would say there's little things like that they can do to help improve their safety, like cracking the window and at their seat and in multiple places, obviously weather permitting, to improve ventilation on the bus. But yes, I don't think it's necessary to drive your kids. If you're very worried about it, that's a reasonable thing, but they're taking a lot of precautions at the schools and the school systems at large to make buses safe.
Thank you. Dr. Sirota, one parent wants to know, what's the update of risk of childhood obesity, severe COVID?
So, obesity is absolutely a concern of pediatricians before the pandemic. Obesity, we know, is in and of itself, it's an independent risk factor for severe COVID-19 disease. Although the specific risk has not been characterized in children and adults, we know that the risk of being hospitalized is triple for individuals who have obesity. And when we're talking about obesity, we're talking about a body mass index that's in a particular range. In children, that's over the 95th percentile. So children with BMIs that are in this range do experience a more severe course of illness, and they do have a higher risk for needing respiratory support. So that's things like maybe ventilator support or other breathing support when they're in intensive care units. But what I can't tell you is I can't give you a number like we can for adults. And that's because up until this point, there probably weren't enough pediatric admissions overall to really characterize that. But thinking about obesity in this pandemic, it's really like what's been referred to as a collision of two pandemics, because obesity was this growing pandemic in childhood anyway, and now we have the pandemic COVID-19, and they've come together to create this environment where obesity is rising. So we're seeing children whose BMIs were not in this range move into this range over the last year, as well as those who have been there, maybe some worsening. And it's for a number of reasons that are very hard to get around. Of course, when we're able to vaccinate kids, it's going to help, right? We will be less worried about them acquiring COVID-19. But there's something called toxic stress, which is living in an environment through an adverse experience like this. And toxic stress has true physiologic effects on the human body, on a child, and that alone is associated with a greater likelihood of inducing obesity. We have children who have had much less activity. We were sheltering in place for several months, almost still at this time last year. And kids have also just had less opportunity for activity in general. Many kids had their activity either at school, which they didn't go to last year, or through organized sports or activities that they weren't able to participate in because of safety issues. There's been more family stress, and that impacts everyone in the family and also can have factors that contribute to weight gain. And then finally, there has been this tendency toward more eating when children are in the home all day. You know, I often say to my patients, it's like the classroom's in the kitchen, and the food is always there, but also in some cases, less healthy eating for a number of different reasons. So I think as families, we really need to think about these two things coming together beyond just the risk of disease, because the risk of disease overall is low in children, but to come from really a strength-based approach and say, what are our strengths as a family? What can we identify that we can turn around or that we can change so that we don't increase the risk of obesity in our children, which will continue well beyond the time probably that we get past this pandemic. And, you know, let's get our kids back to school, which is a great start to reversing this trend, but also to maybe come up with one or two changes that you can make as a family. I know I always found for my family, we started new schedules, new routines. We still do at the back to school time of year. And what else can we change that maybe is a pattern we've fallen into that is contributing to obesity, not only because of the concerns for sort of lifelong health impact for children, but that alone can increase your child's risk of more serious illness from COVID while we're still in this pandemic and children are not vaccinated. And it is a very, very challenging health issue to address. So I really, really want to encourage you as parents, if you're concerned about this in your children, to reach out to your pediatrician, and know that we have a wonderful dietitian also in Pediatricians who I can tell you just personally has been phenomenal in helping many of my patients over the last few years. So talk to your doctor if this is a concern. Know that the risk is higher, but also know still, we're not here to scare you, that the overall risk of COVID in children, just based on all of these preventive measures we've talked about tonight, is still low. It's increasing, but it's still very low.
Thank you, Dr. Sirota. Dr. Stefani, we got a question from one of our attendees tonight. The question is this: we see reports of kids getting more sick with the Delta variant than the original strain. Can you talk a little bit about how sick are kids getting if diagnosed with COVID due to the Delta variant?
So, I think it's important to recognize that this is still a very much evolving picture for all of us in terms of our understanding and the tracking, just because it's been a relatively recent development. I think from everything that I understand, the symptomatology generally is a similar list with the Delta variant as the COVID, strains we were seeing before. It definitely appears to be a more transmissible variant, which means that more people that are getting exposed will then go on to contract the illness. And so it's definitely a problem in areas that have overall low vaccination rates, which is part of why we're really pushing to get as many vaccine eligible individuals vaccinated as we can, since the vaccines are working well. But I would argue that the symptom list we're likely to see with Delta variant is going to be similar to what we've been seeing up until this point. We just might be seeing greater numbers of affected children and individuals.
Thank you. So the two of you have been working in the offices and seeing patients with COVID. Do you have anything to add to that response? Dr. Sirota, Dr. Adams?
I would just say that we have over the last few weeks continued to see more cases of COVID. Throughout all of Pediatrics, we had gone about 4 weeks without seeing any COVID-19 infections in any patients in any of the practices. But so far, thankfully, none of the patients have been any more ill than what we saw when we were seeing higher rates last fall and then again in the winter and in February.
Thank you. Nancy, anything to add?
I have been working a lot of sick clinics lately, and I agree with everything that both Dr. Sirota and Dr. Stefani said, is that we are seeing an uptick in the amount of kids of all ages, really, that are testing positive for COVID, and that everything we've said about protecting your children, yourself, and others can't be reiterated enough.
Okay. So I have another question for you, Dr. Adams. One parent wrote in, are there any special precautions we should be taking for kids who have food allergies in school as it relates to COVID? What do you tell parents in that situation?
So with regard to food allergies, obviously, I would make sure you're aware of your school's policy with regard to their, do they allow peanuts and tree nuts? And make sure that children have an EpiPen at school in the nurse's office, unless they're old enough to self-administer, but it's always best to have it in the nurse's office. And then again, involve your children in packing their lunches, making sure that they're satisfied with what they have to eat, so that they're not swapping and sharing with other kids who might have a granola bar that was made in a factory with peanuts or something of that nature. With regard to COVID, the hope is that schools are implementing a policy to, again, seat kids at least 3 feet apart while eating. And they should wear a mask until they begin to eat, and obviously put their mask back on right after eating, and wash their hands both before and after lunch. So again, I think contacting your school, making sure they understand how to administer an EpiPen, making sure your children have food they like to eat that is allergen free, and make sure that they know not to swap food with other kids if your school doesn't have a policy for peanuts, tree nuts, and that kind of stuff.
And if I can add, as a parent of a child with food allergies, I think it's interesting all the precautions that are now being taken for COVID prevention are the things that we have classically had to do for her allergen plan. So, the wiping down of surfaces, the sitting further away from people with what they're eating. So actually, a lot of the COVID protections are accidentally making the environment a lot safer for our food allergy kids.
Agreed.
A silver lining. All right. So I know it's already 7 o'clock, but we have one more question that just came in, and I'd like to get to it because I know this is a concern of many people that I've talked to. And one mom on the call tonight asks, what is the risk of getting COVID from the doctor's office if your child is sick and needs to be seen? So I'm going to let Dr. Sirota answer that one.
So that's a great question, because one of the things that has been well documented in pediatric journals throughout this pandemic is that there's some fear of bringing children to the doctor, and fear of those children coming for one reason or another and ending up with COVID infection. And to that end, what we have seen is we have seen kids with new onset of diabetes present much more ill in critical conditions. We've seen children with appendicitis that have finally come to medical attention where it's been much more severe or ruptured. So we've seen some serious conditions in a place where it had progressed far further than when children would ordinarily come to the pediatrician's office. So there's risk that comes from having that fear. So, we certainly don't want that. And we certainly don't want children in our practices going without vaccines, which is happening across the country. There's something like 86 million doses of vaccines that weren't given because people were afraid or weren't getting to the doctor just for routine checkups and care. But I like to tell my family and friends that I work in the absolute safest COVID environment. And that means as a parent and as a patient, the pediatrician's office is the safest place to be. Why? Because we're very concerned about keeping our patients who are unvaccinated, which are most of our patients, safe. And we instituted protocols almost a year ago that creates an environment whereby it is, of course, you can't say impossible, but it's exceedingly difficult for anyone to be in our office and meet what we consider a definition of a close contact for COVID. And it really does take this close contact in order for COVID to spread. So we do things like we don't use our waiting rooms. We distance patients all the time in our office. Patients go into a room. We've change the airflow in our rooms with HEPA filters and changes to our ventilation system. We've instituted, our offices were always clean, but we've instituted additional cleaning procedures. Everyone who takes care of your child wears appropriate PPE, personal protective equipment, and the interactions or the time that someone might pass in a hallway or in a space with an individual who isn't the doctor or who isn't the nurse taking care of your child is so limited that it's not possible, from what we know, to spread COVID in those situations. And so I think it's important to ask that. I think it's very important that all of our patients feel safe when they bring their children to see us and that they come in when they need to. For situations, though, where someone does not need to be seen in person, we offer telemedicine, which of course we offered even before the pandemic. And we're very happy where appropriate to provide telemedicine visits for our patients. But it is probably the safest place. We are making schools safe. I don't want to be misquoted, but I think our offices are probably the safest place that you could be with your child. And we are conscious and have policies and are really conscientious about this. every part of every day that we go to work. And, you know, I am sure Dr. Adams, Dr. Stefani would tell you the same, but this is something that we have a small COVID response team that has worked incredibly hard at and will continue to do through the entire pandemic to prioritize your children.
If I could just say one personal note, I'm old and broken down, and I go to the doctor a couple of times a month. And I've done so for the last 18 months while this pandemic has been going on. And let me tell you, Dr. Sirota is right. It's a lot of different types of environments that I've been exposed to, but I feel safest when I'm in a pediatrist office because I know everybody there is doing everything they can to keep the kids safe. Because, you know, in the first part of the pandemic, none of them were vaccinated. And, you know, over the last several months, just the oldest ones who rarely come to the doctor's office have been vaccinated. So we are very, very committed to that. So thank you for that summary, Dr. Sirota. All right, it's after 7, and I promised that we would wrap this up in about an hour, and it's been a little bit more than that. So I want to thank our panelists, Dr. Sirota, Dr. Adams, Dr. Stefani, for helping out tonight. And I want to remind everybody that this entire webinar is recorded, and will be the link to that recording will be sent out in an email to everyone who registered, you know, over the next few days. At some point this week or early next week, you'll get that email. All right, everybody have a very safe school year and a healthy one, and hopefully this school year will be a lot better than last year. Good night, everyone.